My numbers are increasing faster than my gestational age. What numbers are we talking about? Blood pressure. You're smart. Of course, my name is Juliana Ome, and we are doing this together. Hypertension diseases in pregnancy is the topic. Hypertension is defined as a systolic blood pressure greater than 1 or equal to 140 millimeters of mercury, and a diastolic blood pressure greater than or equal to 90 millimeters of mercury. So if the first reading, which is called systolic blood pressure, is 140 or more than that, it is hypertension. Or if the second reading, which is called diastolic blood pressure, is 90 millimeters of mercury or more, it is hypertension. Or if the two readings are equal to or greater than 140 over 90 millimeters of mercury, it is hypertension. Note that there are rules to making diagnosis of hypertension, which the doctor observes before he arrives at the diagnosis. For example, there are stimulants that will naturally increase your blood pressure. There are activities too that when you engage in them, your blood pressure will be temporarily high. Under such circumstances, diagnosis of hypertension is not made. So it is strictly your doctor's diagnosis. Hypertension is the most common medical condition encountered during pregnancy. That's why I thought it wise to bring it to our notice so that we can pick up certain tips that will help us stay safe. According to the Joint National Committee, JNC7, there are 4 ways to classify your blood pressure. It's either normal, or in pre-hypertension stage, or in stage 1 hypertension or stage 2 hypertension. Normal blood pressure is when your blood pressure is less than 120 over less than 80 millimeters of mercury. Pre-hypertension is when the first reading is between 120 to 139 and second reading is between 80 and 89 millimeters of mercury. Stage 1 hypertension is when the first reading is between 140 and 159 millimeters of mercury all over, second reading between 90 and 99 millimeters of mercury. Stage 2 hypertension is when the first reading is greater than or equal to 160 and the second reading is greater than or equal to 100 millimeters of mercury. Now, please, this diagnosis cannot be made by self-assessment. You have to be checked by a doctor. You can't sit at home and make diagnosis of blood pressure because you have a BP monitor. Endeavor to be checked at the hospital before you declare your BP high. Now, the meat of the matter. Hypertension disease in pregnancy. There are 4 basic categories of hypertension disease in pregnancy. I'll do my best to simplify them, so just follow me. The first is chronic hypertension. The second is preeclampsia stroke eclampsia. The third is preeclampsia superimposed on chronic hypertension. The fourth is gestational hypertension. Chronic hypertension is defined as a blood pressure reading that is more than or equal to 140 over 90 millimeters of mercury before pregnancy or before 20 weeks of gestation. So if your pregnancy is less than 5 months and your blood pressure reads above 140 over 90 millimeters of mercury, it is assumed that you were already hypertensive before you became pregnant and you were probably not diagnosed. Hence, it is not caused by the pregnancy. This is the type we call chronic hypertension. The second one, preeclampsia. This is when hypertension develops in pregnancy in addition to protein in the urine, with or without body swelling, what we call edema, and it occurs after 20 weeks of gestation in a woman with normal readings. So this is the type of hypertension in pregnancy common in first-time pregnant women. So you should take your routine urinalysis serious when you go for antenatal care. Then preeclampsia superimposed on chronic hypertension. Just as the term goes, it is when an adult female who is already hypertensive develops preeclampsia. It presents after 20 weeks of gestation. So what differentiates this from preeclampsia is that it occurs in women who are already hypertensive. Thank you. Then gestational hypertension, the fourth one. This refers to hypertension with the onset after 20 weeks of pregnancy without any other features of preeclampsia like protein in urine and body swelling. But then the BP normalizes after delivery. That is, in the first half of a pregnancy, you had normal blood pressure and suddenly your blood pressure goes up without additional symptoms, and then after delivery, it normalizes. It is gestational hypertension. This is the one that was formerly called pregnancy-induced hypertension, PIH, yes. So next question is, what could be responsible for increasing blood pressure in pregnancy? The cause depends largely on the type of hypertension we are talking about. But for the for this particular series, we shall dwell more on preeclampsia because it is the commonest. The cause or mechanism by which preeclampsia occurs is not certain. However, there are multi-theoretical factors shown over the years to be responsible. This means that there are different speculations, from maternal immunologic intolerance to abnormal placental implantation to genetic, environment, and nutritional factors to cardiovascular and inflammatory changes. Don't break your head over these terminologies. Just know that we are suspecting that there's something wrong, there's something about the mother's body that is not accepting the pregnancy as it ought, and hence making the body react in certain ways, so that the blood pressure is high and it's probably, protein in the urine. It's like this, the body is complaining about the new changes and then they shout out, to complain. So another theory says that the culprit is the placenta. The placenta is the organ that supplies baby with nutrients in the uterus, and there are different speculations. So what makes one pregnant woman have greater chance of developing preeclampsia than another pregnant woman? These are what we call risk factors. They only increase the likelihood. They are not the causes. And number one is extremes of age. If a pregnant woman is below 18 years or above 35 years of age, there's likelihood of preeclampsia occurring. Black race, family history of preeclampsia. Your mother had it when she was giving birth. Your other sister had it. Your other sisters, have it. You're likely to have it. Then obesity, existing chronic hypertension, presence of other medical conditions like renal disease, diabetes, twin gestation. Then previous history of preeclampsia. If it occurred in your past pregnancies, you may develop it. It's not a must. Inter-pregnancy intervals less than 2 years or more than 10 years. Then what are the features of preeclampsia? There may be no symptoms, especially if it's a mild preeclampsia. Then visual disturbance like blurry vision, double vision, dizziness, new onset headaches. A pregnant woman complaining of constant headaches that are not going away, don't just assume it is stress. Go to the hospital. Then of course increased blood pressure, then epigastric pains, nausea, vomiting. Of course these symptoms look like pregnancy related complaints, so most people will just leave it and relax and say, hey, it's pregnancy now. My dear, every symptom should be related to your skilled birth attendant. The urinary symptoms, non-dependent edema. For example, you wake up in the morning, your body is swollen, round the clock your body is swollen, is a red flag. This is different from the normal pedal edema in normal pregnancy, where your leg just swells and when you walk around it reduces. Then seizures can occur when these symptoms are ignored or when they are wished away. Then we call it eclampsia. That thing when someone says it's not my portion, it can't be me, it's not for me. When these things worsen and you see a pregnant woman fitting or jerking, seizing, some people will say it's witchcraft, that she's been attacked. Please just get yourself checked first and know that preeclampsia can make you have seizures in pregnancy, especially when it is uncontrolled. So you have so much to benefit from proper antenatal care. So what am I to do when I notice these features? There are only 3 things to do. Go to the hospital. Go to the hospital immediately. Go to the hospital now. So if you're listening to me and you have these features, please pause and move to the hospital. The ultimate aim of management of preeclampsia is safety of mother first. Then basically the principles will include control of hypertension, prevention of seizures, safe mother, followed by delivery of the baby or babies. Then if your doctor recommends delivery by cesarean section, just know that it's for your safety. Please just ask all possible questions and make an informed decision. Then how can I possibly prevent this from happening? The first key is preconception care, during which a risk assessment is done for you and preventable risk factors are taken care of. You should take a look at the video on preconception care. Research shows that certain therapies can help reduce the chances of developing preeclampsia in the presence of risk factors. Examples are supplemental calcium, magnesium, low-dose aspirin. But for you to benefit from these therapies, you should visit your doctor first for proper clinical assessment and recommendation, because it is on a case-by-case basis, it's not for everyone. So this information is to keep you informed and help you be your best, whatever your blood pressure reading is during pregnancy, because they can be managed. Once again, every mother has the right to life while giving life to another. Please pay close attention to your blood pressure values during pregnancy and take the right decision. Thank you very much. Make sure you share this video and share this information with everyone. Stay tuned and make sure you subscribe. Thank you very much and see you again.